The rotors came before the light did. A Black Hawk helicopter punched through the pre-dawn fog above Harlow County General Hospital, like something out of a war zone, its landing lights flooding the rooftop helipad with blinding white. Before the skids even touched down, the side door was already sliding open. Armed operators in tactical gear dropped onto the concrete, moving fast, moving clean, the kind of men who didn't knock and didn't explain. The charge nurse at the main desk had barely set down her coffee when the stairwell door burst open and the lead operator looked her dead in the eyes and said 4 words that stopped every clock in the building. "Where is Claire Donovan?" The problem, the one nobody in that hospital had bothered to consider, was that Claire Donovan had been fired exactly 22 minutes ago. Before all of that, there was just a Tuesday. The kind of Tuesday that didn't announce itself as anything significant, that arrived like every other shift at Harlow County General. Gray morning light pressing against the ambulance bay doors, the smell of floor disinfectant and burnt break room coffee, the distant rhythm of monitors and intercoms that never fully stopped. Casper Falls was not a city that inspired much. It sat in a long valley between 2 unremarkable ridges in the middle of a state people mostly drove through, and its hospital reflected that. Not bad enough to be famous for failing, not good enough to be famous for anything else. 14 floors, 2 trauma bays, a cardiac unit on the 9th floor that had recently received new chairs, and a nursing staff that had been running on short staffing notices for so long that the notices had become wallpaper. Claire Donovan arrived at 5:48 a.m., the way she always did. 12 minutes early. Parked her 8-year-old Subaru in the far corner of the employee lot. Not because she was required to, but because she'd gotten into the habit of leaving closer spots for staff who had longer walks. She sat in the car for exactly 90 seconds with the engine off, eyes forward, breathing slow. Anyone watching from outside would have thought she was tired. She wasn't tired. She was running a mental inventory she'd been running every morning since she started at Harlow County 14 months ago. Patient census, high-risk cases from the previous shift, anything that might need eyes on it before the official handoff report. She did this without a checklist. She didn't need one. Then she zipped her jacket, grabbed her badge, and walked inside. She was 33 years old, 5'7", compact build, light brown hair. She kept pulled back tight because anything else was a liability in a trauma bay. There was nothing particularly remarkable about how she looked. No commanding presence, no dramatic energy. She had the kind of face that people forgot in hallways and then remembered later, usually when something had gone wrong and they were trying to figure out who had seen it coming. She spoke in a register slightly below the ambient noise of a busy ER, which meant that anyone who wanted to hear what she said had to actually pay attention. Most people at Harlow County General had stopped paying attention to Claire Donovan months ago. That was their first mistake. The ER charge that morning was a nurse named Bev Onslow, who was competent and overworked and had recently given up trying to mediate between the floor staff and nursing administration. She handed off to Claire with the kind of efficiency that came from genuine mutual respect. None of the pleasantries, just the information. 3 patients pending labs. 1 elderly man in Bay 4 whose family had been asking questions the attending hadn't answered yet. A teenager in 6 who'd come in with what was logged as a migraine but whose pupils Bev quietly noted were unequal, though the attending had looked at him for 4 minutes and cleared him for discharge. Claire wrote nothing down. She listened, nodded once, and went to Bay 6 first. The teenager, 16 thin, wearing a school lacrosse hoodie, was sitting up on the gurney scrolling his phone when Claire came in. His name was Marco, and he'd been brought in by his older sister at 3 a.m. after he'd woken up vomiting and confused. The attending's note said dehydration and tension headache, discharge pending. Claire introduced herself, asked him how he was feeling, and watched how he tracked her with his eyes when she moved to his left side. She asked him to follow her pen light. Left pupil, 5 millimeters, sluggish. Right pupil, 2 millimeters, brisk. She asked him when the headache had started. He said yesterday afternoon. She asked if he'd hit his head at practice. He said he didn't think so, then paused, then said there'd been a collision early in the week, but it hadn't seemed like a big deal. He'd told his coach. His coach told him to hydrate. Claire stepped out of the bay, flagged the attending, and said clearly and without excess language, Bay 6 has anisocoria, left pupil non-reactive. He's got a history of recent blunt head contact. I want a CT before he goes anywhere. The attending was Dr. Russell Farrow, 46, trauma chief rotation, man who had spent the last 8 months treating Claire Donovan's clinical observations as an inconvenient form of weather. He glanced at his tablet, then at her, and said, "I cleared him. He's not presenting with focal neurodeficits. The pupils are a focal deficit. He's a teenager with a migraine, Donovan. I'd like it documented that I'm recommending CT imaging before discharge." "Document whatever you want," Farrow said, and walked away. She documented it, precisely, time-stamped, with the clinical reasoning attached. Then she walked back to Bay 6, pulled a chair to Marco's bedside, and told his sister, a 20-year-old woman in a pharmacy school sweatshirt who hadn't slept, that she was going to stay close and that if anything changed, she needed to come get her immediately. 40 minutes later, Marco had a seizure. The CT that followed showed a subdural hematoma, small but active. He was transferred to neuro-ICU within the hour. The neurosurgeon who took the call said in his consult note that the presentation had been caught in a favorable window, and that earlier intervention had almost certainly prevented escalation to herniation. Claire was not thanked for any of it. By noon, nurse manager Sandra Holt had pulled her into the small glass-walled office adjacent to the nursing station and told her, with the particular bureaucratic composure of someone who had rehearsed this, that Dr. Farrow had filed a complaint alleging that Claire had behaved in a disruptive and insubordinate manner that morning. The complaint noted that she had questioned a physician's clinical judgment in front of staff in a manner that undermined team cohesion. Claire sat across from Holt and said nothing for 3 seconds. Then she said, "The patient was transferred to neuro-ICU." "That's not relevant to the conduct issue," Holt said. "It's directly relevant to the clinical issue." "Claire." Holt set down her pen. She was a woman in her mid-50s who wore reading glasses on a beaded chain and who had, at some point in the last 2 years, decided that keeping Dr. Farrow comfortable was more strategically valuable than anything else. "This is your third documented incident in 4 months. There's a process here, and I need you to understand that the process exists for a reason." "What are the other 2 incidents?" Holt opened a folder. "October. You flagged a cardiac patient for a medication hold without consulting the attending. November. You requested a second opinion on a trauma patient's imaging, which delayed the discharge and created patient satisfaction issues." Claire looked at the folder. The October patient had a QTc of 5/10. The medication would have caused torsades. He was transferred to cardiac for monitoring. The November patient had a traumatic aortic injury that the initial read missed. He went to the OR. Those outcomes aren't in dispute. Then what is? Holt looked at her for a long moment. "The way you operate, Claire. You work like you're the only person in the building who knows anything, and that creates friction. It creates a dynamic that's difficult for everyone to work around." Claire held Holt's gaze. She didn't argue. She didn't perform offense or indignation. She simply said, "Is this a formal write-up?" "It's a documented counseling." "Okay." She signed where she was asked to sign, walked back to the floor, and continued her shift. She caught a drug interaction on a post-op patient in Bay 11 before the pharmacist's review came back. She noticed an infiltrated IV line on an elderly woman that had been running for 2 hours without anyone checking it. She did what she always did, which was exactly what the job required and considerably more than what was expected. That was January. By March, Sandra Holt had built a file. It was not a file of failures. Claire Donovan did not fail at her job in any measurable clinical sense. The file was a file of friction, incident reports written with the particular skill of someone who knew how to make competence look like a character problem. Words like overstepping, unilateral, failure to communicate through appropriate channels. The language of institutional self-protection. Each document was countersigned by Dr. Farrow, who had apparently decided at some point in the fall that Claire represented something that needed to be removed from his environment and who had the organizational gravity to make that decision matter. Claire read each document when it was given to her. She signed them. She filed her own clinical notes in response, precise and detailed and entirely without emotional language. And those responses disappeared into the HR folder and were never referenced again. She did not complain to the union rep, though she was entitled to. She did not speak to other nurses about what was happening, though several of them had noticed and had begun to watch with the careful attention of people who understand that what's being done to someone else could easily be done to them. She did not ask anyone for help. She came in 12 minutes early every shift. She worked clean. She kept her mouth shut except when something in front of her required otherwise. In April, a man named Garrett Town came through the ambulance bay after a high-speed collision on the interstate. He was 41, construction foreman, no seatbelt, which everyone noted, brought in with a chest contusion and right rib fractures confirmed on the initial X-ray. The attending on that shift was a second-year emergency physician named Dr. Amy Solis, who was diligent and genuinely good, and who accepted the trauma surgery consult's clearance when it came back 40 minutes later. Garrett was moved to a monitored step-down bed. Claire walked past him on her way to another patient and stopped. She'd seen this before. Not here. Somewhere else, years ago, in a different kind of facility, under conditions that didn't translate neatly to a civilian hospital intake form. She went into his room and asked him how he was breathing. "Okay," he said. "Sore. On a scale. 6, maybe. Does it hurt more when you breathe in or out?" He thought about it. "Both, like in the middle." She took his blood pressure, looked at his neck, looked at the monitor. The numbers were within the acceptable range, but the trend over the last 30 minutes showed a pattern she recognized. A slow, creeping decline in systolic that the automated alerts hadn't flagged yet, because none of the individual readings had crossed the threshold. She went to Dr. Solis and said, "Town in 14. I think he's got a vascular injury." Solis looked at the chart. He was cleared by trauma surgery. The clearance was 40 minutes ago. His pressure's trending down. It's subtle, but it's consistent. I want a repeat CXR and a CT angio. Solis didn't dismiss her. To her credit, she ordered the imaging within 10 minutes, citing clinical reassessment. The CT angiography showed a grade 2 traumatic aortic injury. Garrett Town was in the OR within 90 minutes. The trauma surgeon who scrubbed in pulled Solis aside afterward and asked what had triggered the repeat workup. Solis said one of the nurses had caught the trend. The surgeon nodded and said something about good nursing instincts and moved on. Nobody found Claire to say anything. Sandra Holt found her 3 days later to give her a second formal write-up. The allegation was that she had communicated directly with a physician regarding a major diagnostic concern without first notifying the charge nurse and following the escalation protocol. The fact that the patient had been in the OR for a life-threatening injury was noted in the report and then explicitly stated to be separate from the conduct issue. Claire read it, signed it, and said nothing. The morning of the last shift was cold and clear, the kind of April morning in Casper Falls where the sky turned a thin, brilliant blue before the sun cleared the ridgeline. Claire arrived at 5:48 as always. She took report, noted that there was a trauma patient in Bay 3 who had been admitted overnight with blunt abdominal trauma from a workplace accident. A 37-year-old woman named Delia Ross works at the packaging plant on the south side, brought in by her supervisor at midnight. The overnight note said she was stable, labs unremarkable, imaging negative. Claire went to see her anyway. Delia was awake. She was a broad-shouldered woman with calloused hands and an expression of someone who was used to being told she was fine and had learned not to trust it. She told Claire that the pain in her left side wasn't going away the way she'd expected, that she felt, she used the word wrong, which was not a clinical term but which Claire had learned over years to treat as diagnostic data. Claire pressed her abdomen carefully. Delia's face tightened at a spot in the left upper quadrant. "Was that tender before?" Claire asked. "I told them last night. They said the scan was negative." Claire looked at the scan report in the chart. The read was from an overnight radiology tech with a provisional interpretation. The attending radiologist's final read was not yet in the system. She found the attending, Dr. Farrow, who had the misfortune of being on service again, and told him Delia's left upper quadrant tenderness had increased overnight, that the imaging read was still provisional, and that she wanted a repeat assessment. Farrow looked at her over his reading glasses. I was a man who by now had stopped trying to be subtle about his irritation with her existence. The CT was negative, Donovan. The provisional read was negative. The attending radiologist hasn't... Are you reading radiology reports now? I'm reading the timestamp on the report, which shows, that's enough. He set his tablet down on the nursing station counter in the particular way of a man who was performing patience for an audience that wasn't there. You have a pattern. I have documented your pattern. The patient is stable, and she will be reassessed at rounds. Is there anything else? Claire said no. She went back to Bay 3. She sat with Delia for 4 minutes, asked her a few more questions, checked her vitals again. The blood pressure was 108/70. Not alarming. But the trend, and there was always a trend if you watched long enough, if you checked often enough, if you actually stayed in the room, was downward. She went back to the nursing station, found the charge nurse, and began to document her clinical concern formally. She was 3 sentences in when Sandra Holt appeared at the desk. Holt said, "Claire, my office. Now." Claire saved what she had typed. Then she followed. The termination took less than 9 minutes. Holt had a printed document ready. There was an HR representative present, a young man named Evan Marsh, who had the expression of someone attending a funeral for a person he didn't know. The stated grounds were cumulative: disruption of clinical workflow, repeated failure to follow communication protocols, and, the phrase that would have been funny if it weren't being said with a straight face, creating an environment of distrust between nursing and physician staff. Claire read the document. She said, "I have a patient in Bay 3 with—" "That patient is being seen to," Holt said. "Please surrender your badge and your access card." Claire looked at Holt for a long moment. The room was very quiet. She unclipped her badge from her scrub top, set it on the desk, unclipped the access card from her lanyard, set it next to the badge. "Her left upper quadrant tenderness has increased," Claire said. "The CT read is still provisional. Someone needs to check her." "That's being handled." "I need that documented." Marsh looked at Holt. Holt said, "It's noted. You need to leave the premises now, Claire." She picked up her personal items from her locker: phone, keys, the small folded note she kept in her jacket pocket that had nothing written on it, just a habit from a long time ago, a folded piece of paper that had come to feel like ballast. She walked through the ER without speaking to anyone. She pushed through the ambulance bay doors into the cold morning air and stood in the parking lot and breathed. She'd known it was coming, not exactly when, not exactly like this, but she'd known. And still, standing in the cold with her badge gone and the building behind her and 12 years of clinical instinct still running hot under her sternum, she felt the particular vertigo of it. Not grief, not rage, something quieter and more disorienting. The feeling of a machine that has been turned off before it finished what it was built to do. She walked to her car, got in, sat. She checked her phone, 6:17 a.m. The sky was fully bright now, pale and cold, the ridge to the east throwing a long shadow across the valley. She should call someone. She had a lawyer's number in her contacts, a civil attorney who handled employment cases, and who had given her a card 3 months ago when a union rep had quietly suggested she might need one. She should eat something. She should figure out where she was going. She sat in the car and did none of these things, and she was still sitting there 11 minutes later when the sound hit her. Low at first, rhythmic, getting louder fast. She looked through the windshield. The helicopter came in from the northwest, dropping altitude hard and fast, its landing lights carving white lines through the morning air as it descended toward the hospital's rooftop helipad with a precision and speed that had nothing to do with a standard medevac. It was a Black Hawk. Military configuration, no civilian markings. It touched down on the roof of Harlow County General with a force she could feel in her chest from the parking lot. She watched the side door slide open before the rotors had even spun down. She watched the operators come out. She sat very still. Her phone rang. Unknown number. She didn't answer it. It rang again immediately. She looked at the number and something in the back of her mind, something old and trained and wired into her before this parking lot, before this city, before 14 months of being told she was a problem, went very, very alert. She answered. The voice on the other end was calm and clipped and did not bother with pleasantries. "Is this Claire Donovan? Former Sergeant First Class, Medical Operations, 75th Support Battalion?" She said yes. "We need you inside the building, ma'am. Right now." "I no longer work in that building." A pause. Then, "We know. We're working on that. But we need you inside first." Through the windshield, she could see the ambulance bay doors open. A man in tactical gear came through them, scanning the parking lot. His eyes landed on her car. He started walking toward her. Claire Donovan watched him come and felt something shift in her chest. Not fear, not excitement. Something older than both of those. The particular internal click of a person who has been running one kind of life and has just been recalled to another. She put her hand on the door handle. She opened the door and got out of the car. The operator reached her in 8 seconds. Up close, he was younger than she'd expected. Mid-20s, jaw set, eyes doing the constant peripheral scan of someone who hadn't fully switched out of a threat assessment mode. He wasn't hostile. He wasn't anything except focused and in motion, which she recognized as its own kind of language. "Ma'am." He didn't reach for her arm, didn't crowd her space, just positioned himself at her shoulder in a way that indicated direction without being force. "We need to move." "Who sent you?" "Colonel Devin Marsh, SOCOM medical liaison. He'll brief you inside." She walked with him. Not because she'd decided to comply. That word didn't quite fit. But because she had looked at the Black Hawk on that rooftop and understood at a frequency below conscious thought that whoever had dispatched it had not done so lightly. That kind of asset, at this hour, in a mid-sized valley hospital in Casper Falls, meant something had gone severely wrong somewhere in a chain of events that had reached its endpoint here. In her parking lot, 22 minutes after she'd lost her job. She pushed through the ambulance bay doors, and the hospital swallowed her again. The ER was not in chaos, but it was in the specific tightened state of a place that had been interrupted. Staff were clustered near the nursing station in small groups, not speaking much, watching. 2 more operators were positioned near the main corridor, not blocking it, just present in the way that made everyone aware of their presence without a single word. The charge nurse, a woman named Petra, who had worked this floor for 11 years and who Claire genuinely liked, caught her eye across the space and gave her a look that was equal parts bewilderment and something that might have been relief. Sandra Holt was standing near the nursing station with her arms crossed and her face set in an expression of institutional authority that was visibly struggling to hold its shape. Dr. Farrow was beside her. Neither of them said anything when Claire walked in. Holt's eyes went from Claire's face to the operator at her shoulder and back, and something in her jaw tightened. A man in uniform stepped forward from the corridor. He was in his late 40s, compact, with the posture of someone who had stopped needing to perform authority a long time ago because it simply emanated. His name tag read Marlowe. I was a colonel, and he looked like he'd already had a long day at an hour when most people were still on their first coffee. "Sergeant Donovan," he said. "I haven't been that in a while," Claire said. "You are to us." He didn't soften it or dress it up. "I'm Colonel Marlowe, SOCOM Medical. We have a situation. We need your skill set, and we need it in the next 40 minutes. I was just terminated from this facility." "I know. We'll address that." He glanced once at Holt. Not threatening, not contemptuous, just acknowledging the presence of an obstacle he intended to move around. "Right now I need you to hear the brief." Claire looked at him for a moment. "Where?" "Conference room, 2 minutes." She followed him down the corridor, the operator falling back, giving them space. Behind her, she heard Farrow say something to Holt in a low voice. She didn't turn around. The conference room was the same beige box where she'd sat through quarterly compliance trainings and one particularly grim meeting about parking lot security. Marlowe closed the door. There were 2 other people already in the room. A woman in her 30s in civilian clothes who had the particular stillness of someone from an intelligence background, and a younger man in uniform with a medical insignia who had a laptop open and wasn't looking up from it. "Sit, please," Marlowe said, then seemed to reconsider the formality of it. "Or stand. Doesn't matter." Claire stood. Old habit. He briefed her in the clipped, sequential way of someone trained to transfer maximum information in minimum time. A special operations team had been operating in a classified theater. A critical casualty. He used the word asset, then corrected himself to operator in a way that suggested he wasn't sure what she'd been cleared for and was calibrating on the fly. The operator had sustained a penetrating chest injury during extraction. He was currently aboard the Black Hawk on the roof, 2 trauma physicians from Braxton Military Medical already working him, and those physicians had reached the edge of what they could manage. "The attending at Braxton is Dr. Karev," Marlowe said. "Good surgeon. He's telling me the presentation is atypical and he's losing ground. He requested a specific consult." "Me?" Claire said. "You?" "Why me specifically?" Marlowe looked at her steadily. "Because you worked this kind of injury in the field 3 times and had outcomes that shouldn't have been possible with the resources available. Because you wrote the protocol that Karev's team is currently using and failing with. And because 18 months ago, before you dropped off the placement program's radar by taking a civilian nursing position here, your file was flagged as a Tier 1 medical asset. The room was quiet for a second. I took a civilian job, Claire said. You did, and we let you because you'd earned it. He paused. We're asking you to come back, temporarily, for one patient. She looked at the woman in civilian clothes, who still hadn't moved or spoken. Who's she? Agent Rourke. She'll explain her piece afterward. Right now? Are you coming? Claire thought about the parking lot, the 9-minute termination, the badge on Holt's desk. She thought about Delia Ross in Bay 3, whose CT read was still provisional, and she thought about the fact that she'd documented her concern and nobody had listened, which meant Delia was probably still in that bed with a left upper quadrant that was getting worse and a chart full of notes that everyone would ignore until they couldn't. She thought about all of it for approximately 3 seconds. I'm coming, she said. But someone needs to reassess the patient in Bay 3 before we go up. Left upper quadrant tenderness, downward pressure trend, provisional CT read. She needs a repeat workup. Marlowe looked at the young uniformed physician. The physician looked at Claire. What's your clinical suspicion? Splenic laceration with delayed presentation. Could be contained, could be bleeding slowly. She said she felt wrong. She's been saying it since midnight. The physician stood up and closed his laptop. I'll see her. Use the name Breyer when you talk to her, Claire said. She told me that's what people call her. She relaxes a little when you get it right. He nodded. That was enough. The rooftop was cold and loud, and the Blackhawk's rotors were still turning at idle, which meant someone had made the calculation that they might need to move fast. Claire ducked under the rotor arc without thinking about it, pure muscle memory from a life that felt distant until moments like this one, when it didn't feel distant at all, when it felt like she'd just stepped back into it through a door she hadn't known was still there. Inside the aircraft, the space was organized chaos in the way that military medical spaces always were. Controlled mess. Nothing where it looked like it should be, and everything exactly where you needed it. 2 physicians were working the casualty. The patient was a man in his late 30s, large through the chest and shoulders, with the kind of build that came from years of load-bearing physical work. He had a penetrating wound to the right chest, entry approximately 4th intercostal space, and both physicians had him on supplemental oxygen with a chest seal in place. Claire crouched beside the patient. She didn't introduce herself to the physicians. She just looked. Dr. Karev, 50s, silver at the temples, the kind of calm that surgeons either cultivated or burned out, glanced at her. Donovan? Yeah. He's been deteriorating for 20 minutes. Pressure's down to 84 systolic. We've got a seal on the entry wound, 2 large bore IVs. He's getting O-neg. I don't have a good read on the trajectory. She looked at the chest, looked at the seal, looked at the rise and fall of the patient's breathing, asymmetric, the right side lagging. She put her hand flat against his chest wall and felt. The seal's trapping air, she said. Karev said, the wound is sealed. There's a secondary bleed source. He's developing a tension on the right. Look at the trachea. Karev looked. The tracheal deviation was subtle, not the textbook dramatic shift, not the kind that showed up clean in a teaching slide. Just a few millimeters. The kind of thing you missed if you were focused on the primary wound site. Drain the chest first, Claire said, before anything else. If I'm wrong about the tension, you're not wrong. Look at his neck veins and look at that trachea and tell me you're wrong. A pause. Not a long one. Karev was a surgeon who had been doing this for 20 years, and he knew the look of someone who had seen something real, and he recognized it in her face. Prep a needle, he said to his colleague. The decompression took 40 seconds. The rush of air was audible even over the rotor noise. The patient's chest expanded symmetrically on the next breath. His systolic climbed, 84, 91, 97. Not fast, not dramatic, but real and sustained. Claire sat back on her heels. Her hands were steady. Karev looked at her across the patient. He didn't say anything for a moment, then, where do you want to go from here? Get him down to a surgical suite. The entry wound is going to need exploration. I want to know if there's a rib fragment near the pericardium. His rhythm's been irregular since I got up here. We can use the facility's OR. Then let's move. They brought the patient down through the service elevator, which was wide enough for the gurney with 6 inches to spare on each side. Claire walked alongside, one hand on the patient's wrist. Not checking the pulse, exactly, more like staying in contact, which was something she'd done in the field and had never been able to fully explain. Her instructors had told her it was superstition. She'd learned to ignore that opinion. The ER had rearranged itself around their arrival. Staff had cleared the main corridor. Someone had called the OR charge, and the suite was being prepped. The kind of institutional mobilization that happened when a sufficient level of authority entered a building and made clear that things were going to be done a certain way now. Dr. Farrow was standing near the nursing station when they came through. He looked at the patient. He looked at Claire. He said nothing. Sandra Holt was not visible. She had, at some point in the last 20 minutes, retreated to her office and closed the door. Claire registered both of these things with the part of her brain that was not currently occupied with the patient, filed them without judgment, and kept moving. In the OR anteroom, Karev turned to her. "You scrubbing in? That's your call. I'm asking what you think." "I think you're a better surgeon than I am," she said. "I think I've seen this injury type in field conditions you probably haven't encountered. So yes, I'll scrub in if you want another set of eyes." "I want you across the table from me," Karev said. "Let's go." She scrubbed methodically. Not fast, not slow, 30 seconds per hand the way she'd been taught, the way she still did it even after 14 months of civilian nursing, and walked into the OR with the familiar weight of the environment settling around her. Different from the ER floor. Contained, bright, the specific smell of a surgical suite that is both clean and serious. She felt something inside her loosen slightly. Not relief. More like alignment. The feeling of being in the right space for what you actually were. The surgery took 2 hours and 11 minutes. There was a small rib fragment within 4 centimeters of the pericardium, as she'd suspected. Karev worked it out with the kind of precise deliberateness that confirmed her assessment of him. She was not the primary operator, but she was useful 3 times. Once catching a bleeding point Karev had moved past, once suggesting an approach to the cavity closure that reduced the dead space, and once when the patient's rhythm destabilized and she read the monitor and said pericardial effusion, "Check it now," and was right. By the time they closed, the patient's pressure was holding at 118 systolic, and his rhythm was sinus, with occasional PVCs that were already spacing out. Karev stripped his gloves, looked at her. "Where have you been?" "Casper Falls," she said. "Doing what?" "Nursing." He considered this. "That seems like a waste." "It wasn't," she said, and meant it, though the morning had made it feel differently weighted than it had 2 hours ago. She found Agent Rourke waiting outside the OR in a chair against the wall, jacket on, a cup of coffee in her hand that she hadn't drunk. Rourke was the kind of woman who occupied space economically. No excess movement, no performance. She stood when Claire came out. "Good outcome?" she asked. "Ask Karev." "I'm asking you." "He'll make it," Claire said, "barring something I didn't see, which is always possible." Rourke nodded. She held out the untouched coffee. Claire took it, mostly because her hands wanted something to do. "I need to explain why I'm here," Rourke said. "I figured you would." They walked to a small family consultation room down the hall, the one with the box of tissues on the table, and the chairs arranged in a way that was meant to be comforting and mostly wasn't. Claire sat. Rourke stayed standing, which was itself a kind of information. "You were placed in the civilian workforce 14 months ago under a federal transition program," Rourke said. "The program has a monitoring component, not surveillance, more like a welfare check on the administrative side, making sure the transition is functional. Employment status, workplace environment, flag anything unusual. You've been watching my file. The program's been watching your file. I got involved 3 weeks ago when the pattern of documentation at this hospital started looking less like a performance issue and more like a coordinated removal." She said it without inflection, the way you said a thing that was true and didn't need decoration. "We had reason to believe someone was building a case to terminate you in a way that would also affect your federal nursing credentials, which would have had implications beyond this hospital." Claire held the coffee cup and thought about Sandra Holt's folder, the neatly dated write-ups, the language so consistently shaped around conduct rather than clinical outcome that it had almost seemed like a template. "Who put them up to it?" she asked. "That's what we're still working on. It may be straightforward institutional politics. It may be something with external connections. Rourke paused. Your placement in this facility was not publicly documented, but someone knew enough about your background to understand that discrediting you professionally would have a specific kind of impact. They knew who I was. Someone did. Claire set the coffee down. Delia Ross, Bay 3. Rourke blinked once, the small recalibration of someone who hadn't expected that pivot. The patient? She's been there since midnight. I flagged a clinical concern before I was walked out. If nobody's followed up, Dr. Rourke checked her phone. Whitfield, the military physician. He assessed her 40 minutes ago. He ordered a repeat CT and an urgent surgical consult. She's been moved to prep. Claire breathed out slowly. You were right, Rourke said. Grade 2 splenic lac. They caught it. The relief that moved through her was not neat. It didn't feel like vindication. It felt like exhaustion and something that was almost grief. The particular grief of being right about a thing you desperately wanted to be wrong about, because being right meant it had been close, and close meant all the moments when no one had listened could have ended differently. Okay, Claire said. There's more, Rourke said. There always is. What Rourke explained in the next 12 minutes rearranged the last 14 months in a way that Claire had to consciously keep herself from reacting to, because her face wanted to do things that she wasn't prepared to let it do in front of a federal agent she'd met 40 minutes ago. The documentation that Sandra Holt had built, the write-ups, the incident reports, the language about disruption and protocol failure, had been filed not only with hospital HR, but with the state nursing board, in the form of a preliminary complaint. The complaint was a formal mechanism for triggering a license review, and it had been submitted 2 weeks ago, while Claire was still employed. She hadn't been notified because the complaint was still in its preliminary phase, still technically under internal review at the board, but it existed. It was real. And if it had moved forward unchallenged, it would have initiated a process that could result in a suspension of her nursing license, which would trigger an automatic review of her federal medical certifications, which would, in effect, end her career in any capacity where her specific training mattered. Who filed it? Claire said. Holt signed it. But the language in the document, certain sections, are inconsistent with how Holt writes. We've compared it to other documents she's authored. Someone helped draft it, or drafted it for her. Pharaoh? Possibly. Or someone above Pharaoh who had a reason to want your credentials invalidated. Claire thought about this. She thought about it in the way she thought about complex clinical pictures, starting with what was visible, working backward to what must be true, given the evidence, resisting the pull toward a conclusion that was emotionally satisfying rather than logically supported. She had been targeted. That part was now clear. Whether it was simple institutional malice or something more deliberate, she didn't yet know. But the shape of it, the consistency of the documentation, the timing, the fact that someone had known enough about her federal placement to understand what a nursing board complaint would trigger, didn't feel like Pharaoh deciding he didn't like her and getting creative. Pharaoh was petty. This was organized. What happens now? She asked. The complaint is being stayed, Rourke said. Colonel Marlowe filed a federal intervention this morning, which pauses the board process pending the military's review. Your federal credentials are protected. And my job here? Rourke looked at her steadily. That's going to be a harder conversation, with different people. Claire nodded. She had known when she walked back through the ambulance bay doors that she wasn't walking back into the same situation she'd walked out of. The geometry of the thing had shifted, but she understood that shifted geometry didn't automatically mean fixed. It meant different pressures, different leverage points, different people in different positions than they'd been an hour ago. She stood up. Where's Marlowe? Main conference room. He's been making calls. And Holt? Rourke's expression shifted by something small. She's been asked to remain on premises. The conference room had more people in it now. Marlowe was there, on a call he finished when Claire walked in. Rourke took a position near the door. The young physician, Whitfield, she now knew, was back, and he looked at Claire when she entered with the expression of someone who had something to report and wasn't sure how to do it. Briar's going to be okay, he said. She asked about you. Good, Claire said. Tell her she was right to trust her own read. He nodded, made a note. Marlowe waited until the room had settled, which was a skill. not forcing silence, just allowing it to arrive. "We've got a situation here that's going to require some coordination," he said. "The immediate medical emergency has been managed. What we have now is an institutional problem with federal implications, and that's going to take a different kind of work." "What kind of timeline?" Claire asked. "The nursing board complaint will take weeks to formally withdraw. The hospital's employment action is a separate track." He looked at her without apology. "I'm not going to promise you this gets cleaned up fast. I can promise you it gets cleaned up." "What do you need from me?" "A formal statement about the clinical incidents documented in your personnel file. Your version, your records, your documentation. The stuff that Holt's write-ups describe as protocol violations. I have copies of everything I filed." Marlowe showed something that wasn't quite a smile. "We know. We pulled your documentation logs. The timestamps tell an interesting story." Claire looked at him. "In what way?" "In the way that every incident Holt wrote you up for correlates with a patient whose outcome was directly improved by what you did. We have Marco's neuroconsult notes. We have Garrett Town's surgical report. We have the documentation you put in the chart this morning about Delia Ross, timestamped before you were terminated, followed by no physician response for 53 minutes. He let that number sit in the air for a second. 53 minutes after a documented clinical concern about a patient who turned out to have a grade 2 splenic laceration. The room was quiet. "That's going to matter," Rourke said from the door. Claire thought about Holt's face when she'd set her badge on the desk. The rehearsed composure of it. The way Marsh, the HR representative, had looked anywhere except at her. She thought about Farrow's reading glasses and the particular way he'd said, "Are you reading radiology reports now?" with the tone of a man who had never once considered that the answer might be yes, and yes was saving someone's life. She thought about 12 nurses who had watched all of this happen. "Who else have you talked to?" she asked. "We haven't," Marlowe said. "Not yet, but we will." She looked at the window. Outside, the morning was fully advanced now. Sun over the ridge, the valley lit up in the pale, clear way of early spring. The Black Hawk was still on the roof. She could hear it from here if she was quiet, the low idle of rotors that hadn't been told to stop yet. "There are nurses on this floor who've seen everything," she said. "Every incident, every write-up. A few of them have their own documentation." She paused. "They were scared to say anything while I was still here. They'll be more scared now that I'm not." "We can provide a protected reporting mechanism," Rourke said. "They won't trust a mechanism." Claire turned back to the room. "They'll need to see something happen first. Something real. Something that tells them the people who filed that nursing board complaint are actually going to face a consequence." Marlowe looked at her. "What do you suggest?" "I suggest that whatever you're planning to do about Holt and Farrow, you do it in the building. Today. Where people can see it." The room held that thought for a moment. Then Marlowe said, "That's a reasonable request," and picked up his phone. "Bob." What happened next was not fast. None of it was fast. Anyone expecting the swift cinematic reversal, the dramatic confrontation in the hallway, the instant collapse of the people who had spent months building a case against a woman they'd underestimated, would have been disappointed by the reality, which was administrative and procedural and conducted in the flat fluorescent light of rooms that smelled like recycled air. But it was real. Holt was called back into the conference room at 9:14 a.m. by Colonel Marlowe, who was accompanied by Rourke, and a hospital attorney who had arrived 20 minutes earlier with the expression of a man who had not been given enough information about what he was walking into. Holt arrived with her folder of documentation and her reading glasses, and her particular form of administrative composure, and she sat down across from Marlowe, and Marlowe placed a printed copy of the nursing board complaint on the table between them. He said, "Tell me about this." Holt looked at the document. Her composure held for approximately 4 seconds. Then it didn't. Claire was not in the room. She was in the corridor outside, sitting in one of the hard plastic chairs that lined the wall, and she could hear none of what was being said beyond the door. But she could see the door. And she could see, when Petra came down the corridor 10 minutes later with 2 cups of coffee, one for herself, one extended toward Claire without comment, that the floor had gotten very quiet in the particular way that floors got quiet when something significant was being contained behind a closed door. Petra sat down next to her without asking. "How are you doing?" she said. "I don't know yet," Claire said. That was the honest answer. Petra nodded. She drank her coffee. After a moment, she said, January, Marco. Yeah. His mother sent a card. Holt never put it up. Petra reached into her scrub pocket and pulled out a folded envelope. She held it out. I kept it. I don't know why exactly. Maybe I knew it would matter eventually. Claire took the envelope. She didn't open it. She just held it. Down the hall, the door to the conference room opened. The hospital attorney came out first, already on his phone. Then Rourke, who looked at Claire briefly and gave a single small nod that communicated more than a paragraph would have. Then Holt, who walked out of the conference room and down the corridor without looking at anyone, her folder pressed against her chest and her face doing something complicated that Claire recognized from a long time ago. The face of someone who had just been shown, in specific documented detail, the gap between the story they'd been telling themselves and the thing they'd actually done. Claire watched her go. She thought about 14 months. She thought about the badge on the desk. She thought about Delia Ross saying, I feel wrong in a voice that no one else had taken seriously. And she thought about what wrong could have become if no one had listened. The envelope in her hand was light. A card from a teenager's mother who didn't know the name of the nurse who'd caught what everyone else missed. She still didn't open it. She just held it and waited. And outside, the Black Hawk on the roof finally spun its rotors down to silence. The silence from the rooftop lasted about 4 minutes before Marlowe's phone rang. I was back in the corridor by then, standing near the window at the end of the hall with his jacket unbuttoned and his phone already at his ear before the second ring finished. Claire watched him from her chair. She'd learned to read the back of people's heads during long field rotations. The way a shoulder dropped meant one thing, the way a spine stiffened meant another. Marlowe's spine stiffened. He turned around and looked at her. We have a second problem, he said. She stood up. He covered the phone briefly. The operator, our patient. His pressure's dropping again. Karev thinks there's a secondary bleed they missed in closure. He wants you back in. Claire was already moving. Oh. The OR was tense in a different way than it had been the first time. Not the organized urgency of initial intervention, but the particular strain of a team that had thought they were finished and discovered they weren't. Karev was at the table, still gloved, the patient's chest reopened with a second set of retractors in place, and the scrub tech was running behind him, handing instruments with the mechanical efficiency of someone who had stopped thinking about anything except the next step. What are we looking at? Claire said, pulling her second set of gloves. Posterior intercostal vessel, Karev said. I thought we had it. We didn't. He moved slightly to give her a line of sight. The field's compromised. I need another pair of eyes on the approach before I go after it. She looked. The bleeding was venous, slow and dark and persistent, the kind that didn't kill you fast but killed you reliably if you didn't address it, a leak in a low-pressure system that would fill the chest cavity over hours. The vessel had retracted into the tissue during the first closure, which was not negligent so much as anatomy being uncooperative, which it regularly was. Tilt him 15 degrees left, she said. Open the view. You'll see the origin point. The table moved. Karev adjusted his angle. A pause. Got it, he said. And then 7 minutes later. Got it. It wasn't elegant. The repair took longer than anyone wanted, involved a suture technique she suggested when Karev's first approach didn't give him adequate purchase, and required the circulating nurse to call down for a specific instrument that took 4 minutes to locate because it was in a storage cabinet that someone had reorganized without updating the inventory list. The 4 minutes felt longer than they were. The patient's pressure trended down to 88 before it responded to the repair and began climbing back. By the time they closed again, it was past noon. Karev looked older than he had that morning. Not in a dramatic way, just the ordinary depletion that accumulated across a morning like this one, the kind of tired that didn't show until the adrenaline stopped underwriting it. He pulled his mask down and leaned against the wall and said, he needs a minimum of 48 hours of monitoring before we move him. This facility? Claire asked. Unless you have somewhere better in Casper Falls. He looked around the OR with the faint appraisal of someone accustomed to different infrastructure. It'll do. I've worked with worse. He looked at her. I need you here for those 48 hours. I don't work here anymore. I know. I've been told that's being addressed. He said it with the bluntness of a man who spent his professional life in conditions where administrative problems were simply obstacles to move through, not things that required emotional processing. Until it is, consider yourself on loan to my unit. I have the authority to requisition your services temporarily under the medical liaison protocol. I'm invoking it. You can do that? I just did. He pushed off the wall. Get some food. You've been running on nothing since this morning, and I need your brain working for the next 2 days. She wanted to argue that she was fine, which was not entirely true, and she suspected he knew it wasn't true, which was why he'd said it the way he had, not as a suggestion, but as an order dressed in concern, the only kind of care she'd ever responded to from commanding officers. She went to find something to eat. Bolts. The cafeteria at Harlow County General was on the second floor and served food that was aggressively mediocre in a way that had become oddly comforting over 14 months. She got a container of vegetable soup and a sandwich and sat at a table near the window that looked out over the visitor parking lot, and she ate without tasting much of it because her mind was doing what it always did after a high-stakes procedure, running backward through every decision point, every choice, every moment where the outcome could have diverged. She didn't do this compulsively. She did it deliberately, the way you checked your equipment after a mission. Not punishment, maintenance. The secondary bleed had been caught. The posterior intercostal vessel was repaired. The patient was in recovery with Whitfield monitoring vitals every 15 minutes. Delia Ross Breyer was in surgery for her splenic laceration, which Dr. Karev had confirmed was a grade 2 with active extravasation, caught in a window that the surgical consult had described as fortunate. Claire had nodded at that word and not said what she thought about it, which was that fortune had very little to do with it. She was halfway through the soup when Petra sat down across from her. Petra had changed out of her scrubs into street clothes, which meant her shift had ended, which meant she'd been at Harlow County for over 12 hours. She had a coffee and a look on her face that was not quite exhaustion and not quite urgency, but something operating between the two. I need to tell you something, Petra said. Okay. Before everything happened this morning, before the helicopter. She wrapped both hands around her coffee cup. There are 4 of us, nurses, who have been documenting things separately, off the books, on personal files. Every incident, every write-up you got, the clinical outcomes, timelines. She paused. We started in November, after the town case. Claire looked at her. We weren't sure what we were going to do with it, Petra said. Honestly, we were scared. Holt has a way of making you feel like the institution is the thing, and the institution will outlast you, and if you're not in its favor, then you're just gone. And we'd watched you get chipped away at, and we hadn't said anything, and she stopped. We should have said something. You're saying it now. I'm saying it now because there are federal people in the building, and it seems like the window is actually open. She set down her coffee. I wanted you to know before we talk to anyone official, that we have it, that it exists. Claire thought about what Marlowe had said, something real, something that tells them it's actually going to matter. She thought about Rourke's careful neutrality and the way she'd nodded in the corridor after the conference room door opened. Talk to Rourke, Claire said. Agent Rourke, the woman in civilian clothes. Tell her you have personal documentation of the incident pattern. She'll know what to do with it. Will it actually do something? The nursing board complaint against me was drafted with language that didn't match Holt's writing style, which means someone else helped write it or wrote it entirely. Your documentation gives them a baseline comparison and a timeline that can establish who knew what and when. Claire paused. It'll do something. Petra nodded. Then she said, The card. From Marco's mother. I have it. Did you read it? Claire was quiet for a moment. Not yet. You should read it, Petra said, and left it at that. She read it in the stairwell on the 3rd floor, sitting on a step with the cafeteria noise a distant murmur 2 floors below and the antiseptic quiet of the hospital above. The card was a standard get-well card that Marco's mother had repurposed. She'd crossed out the printed sentiment inside and written in its place, in cramped even handwriting, 3 paragraphs that covered both sides of the interior. The gist? She'd been at the hospital that morning in January, waiting in the family area while they prepped Marco for the neuro-ICU transfer, and a nurse had come and sat with her for 4 minutes and explained what had been found and what was being done and what the next 24 hours would look like, and had done so in a way that was clear and honest and had not once pretended the situation was less serious than it was, and that had mattered enormously to a woman who had spent 2 hours being told her son had a headache. She hadn't known the nurse's name. She'd asked at the desk and been given a vague answer. She'd sent the card anyway. Claire folded it back along its original crease and put it in her jacket pocket next to the blank piece of paper she always carried. She sat on the step for another minute. Then she heard footsteps coming up from the second floor, fast, and Whitfield appeared on the landing below her with his tablet in his hand, and an expression that told her before he opened his mouth that something had changed. "What?" she said. "The patient's awake," he said. "He's asking for you." Recovery rooms were not designed for drama. They were designed for the opposite: low light, reduced stimulus, the careful slowdown of a body that had been through something significant. The operator, whose name she still didn't know, whose personnel file was classified at a level she hadn't been read into, was partially upright in the bed, attached to a monitor that was showing vitals she scanned automatically as she came through the door. BP 11274, HR 68, SPO2 97 on 2 liters, better than she'd expected. He was a broad man in his late 30s with the complexion of someone who spent significant time outdoors and a face that had the particular quality of people who had made decisions under pressure for long enough that the decisions had left a mark. He watched her come into the room with eyes that were still carrying some of the anesthesia fog, but were working through it. "You're Donovan," he said. His voice was rougher than she'd expected, chest still tight from the surgery. "Yeah. Marlowe told me." He moved slightly, testing his range of motion in a way she recognized. Not deliberate, just automatic, the reflex check of someone whose survival training had wired itself into baseline behavior. His face registered the pain and he stopped. "He said you caught something Karev missed. Karev caught it." I pointed. "That's not how he told it." She pulled a chair to the bedside and sat. "How are you feeling?" "Like someone opened my chest twice." He looked at the monitor. Which apparently they did. 2.5, technically. The second repair was a secondary bleed we found in closure. He absorbed this without visible reaction. "Am I going to have full function?" "Lung capacity should return to normal over 6 to 8 weeks. The rib you cracked complicates that timeline a little. You'll feel it before you stop feeling it. But yes, full function, realistically." "Realistic timeline for return to operational status?" She looked at him. He was asking a very specific question that had nothing to do with her and everything to do with whether the last 2 hours of his life had cost him something irreplaceable. She understood what was underneath it. "Not my call," she said. "But nothing I repaired today should be a permanent limiting factor. You've got a good chest cavity. No structural compromise." He was quiet for a moment. Then, "The chest drain, before Karev got in there." "Yeah." "He told me that's what kept me viable. The tension was going to win eventually. It was the right move at the right time." "How'd you know? Without imaging?" She thought about how to answer this in a way that was honest without being either falsely modest or insufferably clinical. Tracheal deviation, venous distension pattern, asymmetric chest movement, and the fact that your pressure had been declining in a curve that didn't match the primary wound's expected hemodynamics. She paused. "And I've seen it before." "Where?" She held his gaze. "Places you probably know about, and I'm probably not cleared to confirm." Something moved in his face. Not quite a smile. More like the recognition of a particular kind of person. "You were in the program," he said. It wasn't a question. "I was." "And now you're at a county hospital in Casper Falls." "Until this morning, yes." He looked at the window. There was no view, just a blank wall with afternoon light diffusing through the frosted glass. "Marlowe's going to want to talk to you about coming back," he said. "He already has." "What did you tell him?" "I haven't told him anything yet." She stood, checking the monitor one more time by habit. "Get some rest. Your body's still making up its mind about today." "Donovan." She stopped at the door. "Thank you," he said. It was 2 words said without performance, without the compressed formality of military courtesy or the awkward excess of civilian gratitude. Just 2 words, straight. "Don't thank me yet," she said. "You've got 47 more hours of monitoring before anyone's counting anything as a success." She went back into the corridor and stood against the wall and breathed for a moment. The afternoon had a different quality than the morning. Less acute, the specific adrenaline of the surgical crises metabolized down to something that left her steadier and more tired simultaneously. Marlowe found her 20 minutes later near the nursing station on the 3rd floor, which had become an informal operations center over the course of the day. He had his sleeves rolled up, which she'd noticed was a reliable indicator that something procedural had shifted from formal to functional in his thinking. "Holt's been suspended pending investigation," he said. "Hospital board authorized it an hour ago. They moved fast once the attorney explained what was in the federal file." "What about Farrow?" "The state medical board has been notified and a preliminary review of his conduct has been requested. That'll take longer, but the hospital has removed him from trauma service pending internal review." He looked at her directly. "It's moving." "Petra's team, the nurses with the documentation, Rourke's already talked to them. 3 of them gave formal statements this afternoon. A 4th is coming in tomorrow." He paused. "Their records match yours. It's a coherent picture." She thought about the nursing board complaint. The language inconsistency Rourke had flagged. "Do you know yet who drafted it?" Marlowe's expression shifted slightly. Not evasion, more like the restraint of someone who had more information than they were currently in a position to share. "We have a strong lead. It'll be a couple more days before we can confirm." "Is it someone at this hospital?" "Partly," he said, which told her more than he'd meant to. She let it sit. "What do you need from me for the next 48 hours? Stay in the building. Karev wants you on call for the patient. Rourke may need you for additional statements as the investigation develops." He paused. "And I need you to think about what you want." "In what sense?" "Your employment situation here is going to resolve one way or another. The wrongful termination is documented and clear. The hospital will make an offer. You don't have to take it." He said this without pressure, which was its own kind of pressure in the way that genuinely open options always were. "I also need to tell you officially that as of this morning, your federal placement status has been reinstated, which means there are options on that side of the table too." Claire looked at the nursing station. Petra was at the desk, talking to one of the younger nurses, the one who'd started in February and was still in the phase of learning the floor's specific rhythms. She was explaining something about the monitoring protocol, patient in Bay 8, her hands moving in the way they moved when she was being specific about something that mattered. "Give me the 48 hours, Claire said. Marlowe nodded. "That's fair." The afternoon moved in the particular compressed way of hospital time. Not fast, not slow, but relentless in its forward motion, each hour marked by chart checks and vital sign reviews and the small accumulating evidence that the patient in recovery was holding his own. Whitfield proved to be genuinely good, thorough, unassuming, the kind of physician who asked questions rather than announced conclusions, which Claire rated as a significant professional virtue. They developed a working rhythm without discussing it, which was the best kind. At 4 in the afternoon, Rourke appeared at the nursing station with a printed document and a look on her face that Claire had not yet seen from her. Something that was not quite urgency, but was adjacent to it. "The nursing board complaint," Rourke said. "What about it?" Rourke set the document on the counter. "We found the external drafter. It wasn't Farrow." Claire looked at the document. It was a communication record. Email metadata, the kind that Rourke would have needed a federal request to pull. She scanned it. The email origin was a legal firm in the state capital, not a medical law firm, a general litigation firm with a particular specialty in corporate compliance and institutional risk management, the kind of firm that got hired not to sue, but to protect, to create documentation that insulated organizations from liability by redirecting it toward individuals. "Who hired them?" Claire asked. "That's what we're still working on," Rourke said. "But the firm's client list includes 2 hospital groups in this region, one of which has been in acquisition talks with Harlow County General for the past 8 months. Claire looked up. "A buyout?" she said. "A merger, pending. Announced internally 3 months ago, not yet public." Rourke's voice stayed even. "The acquiring group has a standardized staffing model. They've done this in 4 other facilities. They come in, they consolidate, they remove what they identify as institutional friction points." She paused. "We think someone flagged you as a friction point. Because of my background. Because of your background and because you were catching things that, in a facility running at the staffing ratios this acquiring group favors, would not have been caught. And the paper trail of your catching them was becoming a liability for the clinical model they intended to implement. The OR. The morning. Delia Ross's left upper quadrant. Marco's pupils. Garrett Town's pressure trend. All of it caught, all of it documented, all of it from the perspective of a corporate clinical model optimized for throughput over precision. A record of a nurse who was making the system look inadequate by operating above it. They wanted to discredit the documentation, Claire said. If your license is under review, everything you filed becomes potentially challengeable. Your clinical observations become the work of a nurse with a conduct record and an active board complaint. The documentation loses its evidential weight. Rourke said it with the flatness of someone who found the logic appalling, but had been doing this long enough to recognize it for what it was. It's not incompetence, it's strategy. The corridor was quiet around them. Somewhere down the hall, a monitor beeped its steady rhythm. The afternoon light through the window was going amber. Delia Ross, Claire said. Yes. If I'd been removed 2 weeks earlier, before she came in, she would have been discharged with a grade 2 splenic lac that nobody caught, Rourke said. And sometime in the next 12 to 24 hours, she would have started bleeding into her abdomen. Claire did not respond to this immediately. She took the time she needed to hold the full weight of what she was being told, which was not abstract. It was specific. It had names and faces, and a woman who called herself Breyer, and who had said, "I feel wrong," to a nurse who was still 12 minutes early every morning because it mattered to her that things were seen before they became disasters. "How many other nurses have they done this to?" she said. Rourke hesitated. That hesitation told Claire everything she needed to know about the scope of what Rourke was investigating. "That's what we're building now," Rourke said. "You're not the first." The patient's name, she learned at 6 p.m. that evening, was Sergeant Major Dario Vance. Marlowe told her in the recovery room doorway, quietly, while Whitfield was updating the chart inside and Vance was asleep. He told her because she'd earned the information, which was how Marlowe phrased it, which was the kind of thing he said that sounded bureaucratic and meant something. Vance had been running a classified advisory operation for over a year. The injury had occurred during an exfil that had gone wrong in ways that Marlowe was not at liberty to detail, but that Claire could reconstruct from the nature of the wound and the deployment profile. He was one of 12 personnel on the team. He was the only one who'd been hurt. She nodded at the information and filed it in the appropriate place. Not a clinical file, not anything written down. The part of her brain that had been trained to hold classified information and know the difference between what was relevant to her job and what wasn't. "He's going to ask you about it," Marlowe said. "When he wakes up, he's going to want the full picture." "I'll give him what's medically relevant. That's all I'm asking." She checked on him at 7, 9, and 11. The 11 o'clock check was the longest. She sat in the chair beside him for 20 minutes while the recovery floor was at its quietest, watching the monitor, listening to him breathe. He was sleeping properly now, not the shallow anesthesia float of the afternoon, but something deeper, the sleep of a body that had decided to commit to the work of recovery. His color was better. His pressure was holding. At 11:40 p.m., Rourke appeared in the doorway of the recovery room with her coat on and a look on her face that made Claire stand up. "We have a problem," Rourke said. Claire stepped into the corridor and pulled the door nearly closed behind her. "The legal firm," Rourke said, her voice low. "The one that drafted the nursing board complaint. What about them?" "They've been notified that we pulled their communications. That kind of notification happens through institutional channels, which means someone in the federal review process flagged our inquiry before it was completed." She said it carefully, the way you said a thing you were still assembling while you were saying it. "Someone told them we were looking, which means there's a leak somewhere between our office and the board and whatever channel the firm is monitoring." Rourke looked at the closed door behind Claire. "And it means the people behind this know we've connected them to the complaint, which changes their risk calculation." Claire heard the implication before Rourke finished forming it. "They'll try to pull the complaint," Claire said, "or accelerate it." Rourke's jaw was set. "If they file an emergency petition to the board before we can get the stay formally entered into the record, how much time?" Rourke looked at her watch. "The board office opens at 8 a.m. If they file at opening, we have a 30-minute window to counterfile before the complaint gets docketed as active. Once it's active, the stay has to go through a different process that takes significantly longer. What do you need?" "Your full written statement, complete. Every clinical incident, every write-up, every timestamp, with your documentation logs attached. I need it in a format I can file tonight so it's ready to submit the moment the office opens. How long do I have? Rourke looked at her watch again. Realistically, 3 hours. Claire looked down the corridor. The floor was quiet. Whitfield was at the nursing station, updating notes. The monitor through the door behind her was steady. Give me a laptop, she said. Rourke produced one from the bag over her shoulder. Claire took it and walked to the consultation room at the end of the hall and sat down and opened a new document and began. She typed the way she'd always documented, precisely, chronologically, without decoration. Date, time, clinical observation, action taken. Outcome, date, time. The pattern built itself across the screen in the flat, clear language of someone who had learned long ago that the most effective argument was a sequence of facts so well ordered that no one could find a gap to push through. She typed for 2 hours and 40 minutes without stopping. At 2:20 in the morning, she sent the completed document to Rourke's secure address and closed the laptop and sat in the quiet consultation room with the empty cup of coffee that had gone cold an hour ago and the sound of the hospital doing what hospitals did at this hour. The low-grade continuous hum of a place that never fully stopped. Her phone buzzed. A text from Rourke. Received. It's strong. Sending to our attorney now. She put the phone down. She thought about the merger. The acquiring group. 4 other facilities. She thought about Rourke's hesitation when she'd asked how many other nurses they'd done this to, and the way that hesitation had been an answer in itself. She thought about what Marlowe had said, "You're not the first," and the specific weight of those words, which was not about her at all. She was still sitting there at 2:47 a.m. when the recovery floor alarm went off. Not a monitor alarm, not the beep of a threshold crossed. The overhead alarm, the kind that meant a different category of problem entirely. She was moving before the sound finished. Whitfield was already in Vance's room when she got there, and he looked at her over the patient's bed with an expression she had not seen on his face all day, which was the expression of a physician who was looking at something he did not understand. Vance was awake. He was upright. He had pulled his own IV, not accidentally, not in confusion, but deliberately, with the particular purposeful competence of someone who had been trained to function through pain. The monitor showed his pressure elevated, his heart rate elevated, and he was looking at the door with the fixed attention of someone reacting to a threat. "There's someone in the building," he said. His voice was completely steady. "Who told you?" Whitfield started. "Nobody told me." Vance's eyes moved to Claire. "I heard them in the corridor, 2 sets of footsteps that don't belong to hospital staff. Heel strike pattern, interval timing." He paused. "I know the difference." Claire stood very still. From somewhere down the hall, on the other side of the recovery floor's secondary door, she heard what Vance had heard. Not footsteps now, but the specific sound of a door handle being tested from the outside, very slowly, by someone who did not want to be heard. Claire didn't look at Whitfield. She looked at Vance. "How many?" she said. 2, maybe 3. He was already assessing the room with the systematic efficiency of someone who had woken up in bad situations before and had a process for it. They stopped moving when the alarm went off. "The alarm was the floor monitor," Whitfield said. His IV was the alarm," Claire said. "He pulled it to trigger the alert." She looked at Vance. "You needed people in the corridor." Vance said nothing, which was confirmation. She crossed to the door and opened it 3 inches and looked out. The recovery floor corridor was lit at its standard overnight level. Not bright, not dark. The particular institutional dimness of a space that had to be navigable without disturbing patients. She could see 30 feet in each direction. To her left, the nursing station, where the floor nurse on overnight shift, a man named Gus, who had been at this hospital for 9 years and who she knew slightly from evening shift overlaps, was on his feet and looking toward the secondary door. To her right, the secondary door itself, which was a fire exit that required a badge to open from the outside. The handle was still. She pulled out her phone and called Rourke. It rang 4 times before Rourke picked up, voice alert in the immediate way of someone who hadn't been deeply asleep. "Donovan. Someone's trying to access the recovery floor through the secondary fire exit. Vance made them, 2 to 3 individuals." A pause of approximately 2 seconds. "Don't engage. Get Vance to an interior room. No windows, no exterior walls. I'm calling Marlowe. He's just had chest surgery." "I know. Do what you can." The line went dead. Claire went back into the room. We need to move you. Vance was already swinging his legs over the side of the bed. His face did the thing faces did when people were absorbing significant pain and refusing to let it make decisions for them. A compression, a tightening, gone in a second. Where? Supply room, end of the hall. Interior wall, no windows. Can you walk? I can walk. Whitfield, I've got the monitor leads, Whitfield said, already disconnecting them. Not panicked, focused, which was what she needed. He can go mobile. I want a pulse ox on him. Clip it to his finger and move. She went to the door again, checked the corridor. Still clear. Gus was on the phone at the nursing station, which meant the facility security line was active. Now. Vance stood. He moved with the deliberate, careful steadiness of a man overriding a significant amount of pain through sheer practiced will, and he did it without asking for support, though she positioned herself at his left in case he needed it. They went into the corridor, 20 feet to the supply room. She counted the distance the way she'd been trained to count. Not steps, but seconds. Threat intervals, the geometry of exposure. 15 feet. The secondary door at the end of the hall moved. Not opening, just the specific micro-shift of pressure against a sealed door that indicated weight being applied from the outside. Testing it. Whoever was out there had heard the alarm and was recalculating. 10 feet. She got Vance into the supply room. Whitfield came in behind them and pulled the door closed. The room was standard hospital supply. Shelving units on 3 walls, rolling cart in the center, a single overhead light on a motion sensor that had clicked on when they entered. No windows. Concrete block on the exterior side. She positioned herself between Vance and the door. You don't have to do that, Vance said. I know, she said. What's up? Marlowe arrived in 4 minutes, which meant he'd been in the building or very close to it, which meant he'd made arrangements she hadn't known about, and which she immediately decided she didn't need to ask about. He came through the main corridor entrance with 2 operators who moved to the secondary door and a third who took a position at the nursing station. The secondary door was found locked, no sign of forced entry, no one in the external stairwell when Marlowe's team cleared it 20 seconds later. Gone. Not apprehended, just gone, which was its own kind of information. These weren't opportunists or confused individuals. They were people who knew when to stop and leave, which meant they'd had a clear abort threshold and hit it the moment the response changed. Marlowe came to the supply room door. Claire opened it. He looked at Vance, then at her. Anyone hurt? No, she said. He looked at Vance's arm where the IV had been pulled. A small blood track down to the wrist. Can you get him back to the room? Give us a minute. She walked Vance back to the recovery room while Whitfield went to get a new IV set up. Vance sat on the edge of the bed and allowed this. The sitting, the waiting, the particular indignity of being helped. With the patience of someone who understood that fighting the situation would cost him more than accepting it. You knew someone might come, Claire said. It wasn't a question. He looked at the window. When the mission goes wrong in a specific way, there are sometimes people who have an interest in making sure the debrief never happens. Someone wanted you dead before you could report. It's a possibility I've had to consider since exfil. He glanced at her. I didn't say anything to Marlowe because I didn't have confirmation. I had a feeling. You pulled your own IV on a feeling. It was a strong feeling. She processed this. The external access attempt, the abort-the-moment response teams arrived, the timing, hours after Rourke had confirmed a leak in the federal review process. Someone had moved fast once they knew the investigation was live. Fast and directly. The leak, she said, in the federal channel. Rourke flagged it tonight. Vance's expression shifted slightly. Tell me. She told him. He listened without interrupting, which she was coming to understand was his default, full intake before output. When she finished, he sat with it for a moment. The legal firm and the access attempt are connected, he said. Rourke thinks the merger group hired the firm. Rourke's right about the firm. She may be wrong about who hired them. He looked at her steadily. The merger group is a front, or partially a front. There's money moving through it that doesn't originate in hospital acquisitions. The supply room, the dark corridor, the door handle moving. How do you know that? She said. Because the operation that went wrong, he said carefully, was investigating exactly that. Financial infrastructure using healthcare acquisition as a vehicle. He stopped. Which is why certain people need my debrief not to happen. and why your documentation of clinical problems at this specific facility, in this specific window, became a liability they needed to neutralize. Claire looked at him for a long moment. I wasn't just a friction point, she said. No, he said. You were documenting institutional patterns in a facility they were in the process of acquiring, patterns that, if they reached the right people, would have raised questions about the acquisition itself. He said it evenly, without drama. You didn't know any of that, you were just doing your job. And doing my job well enough made me a target. Yes. Whitfield came back with the IV setup and a look on his face that said he'd heard enough of the last 60 seconds to understand that the conversation he'd walked into was above his pay grade. He set up the line without comment, which Claire appreciated. Marlowe debriefed Vance at 3:30 in the morning with Rourke present and a secure recording device running, and Claire was asked to wait outside, which she did, sitting in the hard plastic corridor chair that had become a recurring feature of her day. The conversation inside lasted 40 minutes. She could hear the tone of it through the door, measured, sequential, the particular rhythm of an intelligence debrief, but not the content. She used the time to think. The shape of what she was looking at had changed. It had started as a workplace problem, a nurse manager who built a false paper trail, a physician with an ego and a grudge, a hospital administration that valued institutional smoothness over clinical accuracy. All of that was real. All of that had caused real harm. But beneath it, or rather behind it, the way a stage set has a different structure from the front than from the back, was something larger and less personal. An acquisition, a financial network, an operation that had gotten close enough to the network's infrastructure to threaten it. She thought about the nurses on the 4th floor who had been documenting in private for 4 months. She thought about Petra saying we were scared with the honesty of someone who had earned the right to admit it. She thought about Delia Ross, who had felt wrong and had been right, and about Marco's mother writing 3 paragraphs in a get well card because she didn't know the nurse's name. None of those people had been part of the larger story. They'd just been standing in its way. The debrief door opened at 4:10. Rourke came out first, and her face had changed in a way that Claire had learned over the course of this very long day to read as significant. The firm, Rourke said. We have the name of the individual at the acquiring group who directed the complaint campaign against you. Claire waited. His name is Warren Tull, Rourke said. He's the VP of Clinical Integration for the acquiring group, Meridian Health Systems. His job is to standardize clinical operations at acquired facilities. He's done it in 4 states. Meaning he removes the people who make his standardized model look inadequate. Meaning he removes the people who document that his standardized model produces worse patient outcomes than the facilities had before acquisition. Rourke said it with the flat precision of someone reading from a report she wished she didn't have. We have emails between Toll and the legal firm going back 6 months. They identified you as a target 3 weeks after you caught the town case. The nursing board complaint was drafted in January. They were waiting for Holt to build enough internal documentation to make it credible. And Holt? Holt didn't know what she was part of. Tull's firm approached her through a HR consulting channel. They told her they were helping the hospital prepare for the merger by addressing legacy personnel issues. She thought she was protecting the institution. She wasn't. No. Rourke paused. She was being used to make the targeting look internal, local, a workplace conduct issue rather than a coordinated suppression of clinical documentation. The corridor was quiet. Somewhere in the building, a floor away, a monitor beeped its steady arrhythmic commentary. The hospital kept moving, the way it always did, indifferent to the specific crisis occurring in its recovery wing. What happens to Tull? Claire said. Federal charges are being prepared. The financial investigation, the one Vance's team was running, is now active domestically. Tull's connection to that financial network makes this considerably more serious than a wrongful termination case. Rourke looked at her directly. Your documentation, the clinical logs, the timestamps, the statement you filed tonight, is going to be central to the chain of evidence. What they did to you is the clearest documented example of the suppression pattern. 4 facilities, over 3 years. You're the one who was still filing accurate records when the investigation intersected. Because they didn't move fast enough, Claire said. Because you were harder to neutralize than they expected. Dawn came the way. Dawn came in Casper Falls. Slowly, the light building in stages behind the eastern ridge, the valley filling with gray before it filled with color. Claire had not slept. She'd spent the last 2 hours in the recovery room chair while Vance slept properly, and the monitor ran its steady commentary, and Whitfield checked in every 30 minutes with the conscientious regularity of someone taking the watch seriously. At 6 a.m., Marlowe found her there. He pulled the second chair and sat, which was unusual. He was a man who stood when he delivered information. Sitting meant something different. Toll's been taken into federal custody, he said, early this morning. His attorney will have him out by afternoon, but the charges are filed and the financial investigation has jurisdiction now, which means his movements are restricted and his access to Meridian's operations is suspended pending review. 4 facilities, she said. We're building contact lists for all of them, nurses primarily, a few residents, people who were documented out of jobs or license threatened in the 18 months before each acquisition closed. He paused. It's a long list. She thought about what that meant in the specific clinical sense, not abstractly, not as a number, but as individual people in individual ERs and ORs and floor corridors, catching things, filing notes, being told they were problems, being removed. Patients who had things caught and patients who hadn't, sorted by whether the person who would have caught it had already been removed. The nursing board complaint, she said, will be formally withdrawn by end of business today. The stay is already in the system. Your license is clean and will remain so. He looked at her. The hospital's board met at 5 this morning, emergency session. They voted to reverse the termination and issue a formal apology. They'll want to talk to you about what reinstatement looks like. What did you tell them? That you'd hear them out. He said it simply. I didn't promise anything beyond that. She appreciated the accuracy of that. Farrow? The state medical board has been provided the full clinical record. The Town case, the Marco case, Delia Ross, 6 other incidents from the past 14 months that your documentation and the nurse's statements corroborate. The board has opened a formal conduct investigation. His license is under review. The window in the recovery room showed the same blank wall as always, but the light through the frosted glass had shifted. It was warmer now, the beginning of morning instead of the end of night. Holt, she said, criminal referral for the false professional complaint. The DA has discretion. Given that she was partially manipulated by Toll's firm, there's a reasonable argument for a plea arrangement with cooperation requirements. Marlowe said it without satisfaction, which she respected. It wasn't satisfying to disassemble a person who had been used, even if that person had also made choices. Vance stirred on the bed. His eyes opened with the immediate alert quality she'd observed the night before. No transition, no grogginess, just awake. He registered Marlowe, registered Claire, registered the light in the room, and conducted his morning inventory in approximately 5 seconds. Pressure, he said. 118/76 as of 30 minutes ago, Claire said. Good. He moved his right arm carefully, testing the chest response. His face did the compression. Better than yesterday. You pulled your own IV at 3 in the morning. Desperate times, he said. Marlowe looked between them. I'll let you do your rounds, he said to Claire, and stood and left, which was a small courtesy she noted. She checked Vance's chart on the tablet. His overnight numbers were the best they'd seen since the surgery. The second repair was holding, his oxygenation was strong, the PVCs that had worried her in the OR had dropped to near 0. His body was doing the work. You're going to be fine, she said. I've been told that before in recovery rooms, he said, usually by people who meant we hope. I mean it medically, she said. The structural repair is solid. You're not bleeding. Your lung is working. In 6 weeks, you'll be annoying your PT staff. How many more hours do I have to stay in this room? 22. He absorbed this without argument, which told her he felt worse than he was letting on, because people who felt good argued about discharge timelines. Fine, he said, but I want to know what happened last night. The access attempt. She told him what Marlowe had told her. He listened, and when she finished, he looked at the ceiling for a moment in the way of someone reorganizing a picture they'd been carrying. They'll move the financial infrastructure now, he said. Rourke's team knows that. Rourke's team is good, he said. I want to make sure Marlowe understands the velocity on this. Once Toll lawyers up and gets word out, the network will start collapsing its local nodes. There's a window. Tell Marlowe. I will. I'm telling you first because you're here and he isn't. He looked at her. And because you have a stake in this that you haven't fully accounted for. What stake? You're a witness in a federal financial investigation, which means for the next several months, until the charges are resolved, you're going to have people paying attention to you. That has implications for what you decide to do next. She hadn't thought about it in those terms. She thought about it now, briefly and practically, and found that it didn't change much in the immediate calculus except to add a variable she'd factor in. Noted, she said. He looked at her steadily. You're not rattled. Should I be? Most people would be. Most people didn't spend 4 years in the places I spent 4 years, she said. It wasn't bravado. It was just accurate. What? At 9 in the morning, the hospital board's chair, a woman named Loretta Bangs, who ran a commercial real estate company and who had the controlled energy of someone accustomed to making fast decisions with incomplete information, appeared on the recovery floor with the hospital attorney and asked to speak with Claire. They used the consultation room. Bangs sat across from her and did not spend time on pleasantries, which Claire respected. The board met this morning, Bangs said. We're rescinding the termination effective immediately. Your record will be corrected and the disciplinary documentation removed. She paused. We're also announcing a formal review of all clinical conduct documentation filed in the past 2 years to determine whether the pattern affecting your record exists elsewhere. It does, Claire said. I know. We've been briefed. Bangs's expression was the expression of someone who had learned something genuinely uncomfortable about an institution they thought they understood, and was choosing to respond with action rather than defensiveness. It was, Claire thought, the correct choice, even if it had taken a Blackhawk on the roof to make it available. We'll be issuing a public statement today acknowledging that you were wrongfully terminated and that your clinical record here has been exemplary. The nurses who filed statements with the federal investigators, Claire said, Petra and her team, their employment security needs to be guaranteed explicitly. Done. In writing. Of course. Bangs looked at her. We'd like you to come back. I know. Is that a possibility? Claire looked at the consultation room wall. The same beige box, the same tissue box on the table. She thought about what Marlowe had offered and what Vance had said about stakes, and what Rourke had described in 4 states and a long list of nurses. I need a few days, she said. You can have whatever you need. Bangs paused. For what it's worth, I want to say, on behalf of the board, that what was done to you here was a failure of institutional responsibility. We should have had mechanisms that caught this. We didn't. She said it without the slick professionalism of a prepared statement, which meant she'd actually thought about it. We're going to. I know, Claire said. I'll be following that. What? The public statement went out at 11 a.m. through the hospital's communications office. Claire read it on her phone in the cafeteria over a cup of coffee that was actually hot, which felt like a minor luxury after the night she'd had. The statement was specific rather than vague. It named the wrongful termination, acknowledged the clinical record, and announced the internal review. Bangs had insisted on specificity, which the attorney had resisted and which Bangs had won. By noon, it had been picked up by the local news outlet and 2 regional healthcare publications. By 1 p.m., Claire had 14 text messages from numbers she didn't recognize, and 3 from people she did. Petra, another nurse named Rodrigo, who had been one of the 4 in the documentation group, and the young resident Dr. Amy Solis, who had ordered the repeat imaging on Garrett Town back in April, and who sent a text that said simply, I should have pushed harder then. I'm glad it's being corrected. Claire wrote back, You ordered the scan. That's what mattered. A minute later, Solis responded, I'm testifying to the medical board about Pharaoh, just so you know. Claire set the phone down and finished her coffee. At 2 in the afternoon, Rourke appeared in the cafeteria doorway and walked to her table and sat down with the specific quality of motion of someone carrying news they were still parsing themselves. Tull, she said. What about him? His attorney filed for emergency release and got it, as expected. He's out as of 1 o'clock. She set her phone on the table between them, a document open on the screen. But before the arrest was processed this morning, his firm, the legal firm, received an instruction set from Meridian's executive office. Claire looked at the document. It was a forwarded email chain, heavily redacted. They told the firm to file the nursing board complaint as active before the stay could be entered, Rourke said. This morning, the instruction went out at 6:45 a.m. We filed the stay at 8. The firm filed their petition at 7:58. Rourke's voice was level. 2 minutes before we filed, which means the complaint is technically docketed as active. Claire looked up from the phone. The stay overrides the docket, Rourke said immediately. Our attorney is handling it. It's not going to move against you. She paused. But it means that someone in Meridian's executive structure sent that instruction this morning, knowing Tull had been arrested, knowing the investigation was active, and did it anyway. Who? We don't know yet. The instruction came from a shared executive account. We're working on attribution. Rourke folded her hands on the table. What it tells us is that this didn't run through Tull alone. There's someone above him in this, someone who knows the full scope of what's being investigated and is still willing to move. The cafeteria around them was its ordinary midday self. Lunch trays, a television in the corner running a news channel with the sound off, 2 orderlies at the table by the window eating sandwiches and not looking at each other. The ordinary forward motion of a place that processed emergencies all day and had learned not to wear them visibly. The federal case, Claire said, is now significantly larger than it was yesterday. Rourke looked at her. And your statement, the one you filed at 2 in the morning, is one of the clearest documented threads in it, because you were thorough and you were accurate and you filed every clinical note with a timestamp when it would have been much easier not to. Claire thought about 14 months of 12 minutes early arrivals, of documentation filed into a folder nobody read, of Farrow's reading glasses and Holt's folder and the 9-minute termination, and the particular feeling of setting her badge on that desk. She thought about all of it as what it actually was, which was not a workplace dispute or even a personal injustice, but a documented record of exactly how a clinical suppression campaign worked from the inside. What do you need from me? She said. A formal federal witness designation, Rourke said, which gives you protections but also means you're in this until the charges resolve. How long? Realistically, 18 months. Could be shorter if there are pleas. 18 months. She thought about Marlowe's offer, about Vance's comment in the recovery room, about the long list of nurses in 4 states and the facilities that were already acquired and the ones that hadn't been yet. Okay, she said, you understand what you're agreeing to. I understand. Rourke picked up her phone, started the paperwork on her end right there at the cafeteria table over cold coffee and the background noise of an ordinary Wednesday lunch hour. Claire looked at the muted television in the corner. The regional news channel was running a crawl at the bottom of the screen. She couldn't read it from here. She watched the anchor speak silently and thought about nothing specific and everything at once, the way she did after a complicated shift when the procedures were done and the decisions were made, and what remained was the particular human business of figuring out what to carry forward and what to set down. At that moment, Whitfield appeared in the cafeteria doorway and scanned the room until he found her. He crossed to the table quickly. Vance, he said. She was on her feet before he finished the word. He's fine, Whitfield said immediately. He's fine, the vitals are good, but he's asked to see you. He paused. And there's someone else. Just arrived. He says he's the director of Meridian Health System's regional operations. Rourke looked up sharply. He's in the main lobby, Whitfield said. He asked for the hospital administrator, but he's also asked about the federal agents in the building. He looked between Claire and Rourke. He knows you're here. Rourke stood and her hand was already moving toward her phone. Claire looked at Whitfield. What's his name? He gave his name as Gerald Pratt, Whitfield said, but there's something. The administrator called me because she wasn't sure what to do. The man came in with 2 other individuals she described as legal counsel. He paused. And he has a folder. She said he put it on the desk in front of her. She said it has your name on it, Claire. The cafeteria was very quiet around their table. Rourke said, low and even, don't go to that lobby. But the folder had Claire's name on it, and the man who'd brought it knew the federal agents were in the building and had come anyway, at 2 in the afternoon on the day after Tull's arrest, with lawyers in tow and a folder he was willing to put on a desk in plain sight, which meant either he was catastrophically miscalculating or he knew something she didn't. Wait here, Rourke said, and she was already moving. Claire did not wait there. She followed Rourke out of the cafeteria and down the main corridor at a pace that was not quite running but covered ground faster than a walk. And Rourke either heard her footsteps or accepted that telling her to stay behind had been optimistic because she didn't turn around and didn't repeat the instruction. They reached the main lobby in 90 seconds. Gerald Pratt was not what Claire had assembled in her mind during those 90 seconds. She'd built something sharp-edged and deliberate, a man who looked like what he was. What she found was a man in his early 60s, heavy-set, with the kind of face that had probably been open and unremarkable for most of his life, and had only recently acquired the particular tightness that came from being cornered. He was wearing a good suit, and he was standing at the administrator's desk with two attorneys flanking him like architectural features, and the folder was on the desk exactly as described, white, labeled, her name on the tab in printed type. He saw Rourke first, then Claire. Something moved across his face, not surprise, which told her he'd known she'd come down, had counted on it. Whatever was in that folder, he wanted her to see it. That was its own kind of information, and it made Rourke's instinct to keep Claire away from this lobby make a different kind of sense than simple protection. The hospital administrator, Nora Yoon, was standing behind her desk with the careful stillness of someone who had been managing a situation she hadn't been trained for and was doing it by not moving. She was 40-something, efficient, and she looked at Claire with the brief, specific expression of someone handing off a problem to the person who actually owns it. One of Pratt's attorneys, the taller one, silver-haired, the kind of attorney who billed in 6-minute increments and had a second home, said, "Mr. Pratt is here in good faith to discuss a resolution to the current—" "I know why he's here," Rourke said. She stopped 6 feet from the desk. "Mr. Pratt, I'm Agent Rourke. You voluntarily entered a facility that is currently under active federal investigation. I need to inform you that anything you say—" "I know my rights," Pratt said. His voice was steady in a way that sounded practiced rather than felt. "I came to present documentation." He put his hand flat on the folder. "I'm not here to make this worse." "What's in the folder?" Claire said. He looked at her directly for the first time. "Proof that Warren Tull acted outside the scope of his authority at Meridian. That the campaign targeting your credentials was his initiative, not a company directive." He paused. "And an offer of full cooperation with the federal investigation in exchange for Meridian's separation from the charges." The lobby was very quiet. Nora Yoon had stopped pretending to do something with her keyboard. 2 nurses passing through the main corridor had slowed involuntarily, the way people slowed when the texture of a space changed. Rourke's voice was flat. "You're here to negotiate." "I'm here to cooperate." Pratt said it with a particular emphasis. The emphasis of a man who understood the difference between those 2 words in a legal context and was making sure everyone in the room understood it too. "There's a distinction. The distinction is for your attorney and the federal prosecutor to work out," Rourke said. "Not here." "I understand that." He didn't move his hand from the folder. "But Ms. Donovan deserves to see what's in this first, before any of it goes into the federal process." He looked at Claire again. "Because it concerns more than just what happened to you." Rourke made a call. The call took 4 minutes. When she came back, her expression had shifted slightly. The adjustment of a person who had received information that changed the immediate calculus without changing the underlying situation. "We'll use the conference room," she said. "My people will be present. Both attorneys can attend. Ms. Donovan attends at her own discretion." "I'm attending," Claire said. They used the second-floor conference room, the same room where Marlowe had briefed her that morning, which felt in some uncategorizable way like the right place for this. The same table, the same recycled air, the same institutional light. Marlowe arrived 3 minutes in, which meant Rourke had reached him during that 4-minute call. He stood near the door with his arms loose and said nothing and watched. Pratt opened the folder. The documents were organized, which told Claire that whatever else he was, he'd prepared for this. The first section was an internal Meridian communications record, emails between Tull and the legal firm, already known to Rourke, but annotated here with Meridian's internal metadata showing that Tull had used personal encryption channels specifically to exclude them from standard corporate discovery. The second section was Tull's compensation records, his bonus structure tied to acquisition completion timelines, with specific line items for personnel friction reduction that Claire read twice to make sure she was reading it correctly. She was reading it correctly. They had paid him per removal, per successful elimination of a clinical staff member identified as an obstacle to acquisition standardization. It wasn't labeled that way. The language was corporate, layered, the kind that required interpretation to understand and more interpretation to prosecute. But the structure was there, and the payments correlated exactly with the timeline of terminations at each acquired facility. 4 facilities, Pratt said. Not just Harlow County. We've identified 11 nurses and 2 residents who were targeted through similar documentation campaigns over the past 3 years. Toll built the methodology at the first acquisition and refined it at each subsequent one. You knew, Claire said. I did not know, he said. I want to be very specific about that. I knew Toll ran aggressive integration programs. I didn't know he'd built a systematic campaign using an external legal firm to discredit clinical staff. He held her gaze. When the federal investigation began looking at Meridian's financial connections, I started looking internally. This is what I found. When did you find it? A pause. 2 weeks ago. And you came here today, she said. Another pause. After Toll was arrested this morning, I understood that the window to come forward voluntarily was closing. He said it without pretending it was something other than what it was. He hadn't come forward 2 weeks ago. He'd calculated, and he'd come forward now because the calculation had shifted, and he was at least honest enough not to dress that up as something more principled. The cooperation I'm offering is real regardless of when I decided to offer it. Rourke looked at the documents. We'll need the originals and the chain of custody documentation. You'll have everything. And the financial infrastructure, Marlowe said from the door. The first thing he'd said in the room. Everyone looked at him. The network that Toll's operation was connected to. The domestic financial structure that your acquisition vehicle was partially funding. Pratt's attorney put a hand on his client's arm. Pratt ignored it. He looked at Marlowe for a long moment, and something in his face did the work of a man deciding how much of the room he was willing to walk into. That's a different conversation, he said, with different people present. That conversation starts today, Marlowe said, or the cooperation framing becomes considerably less useful to you. The attorney began to say something about federal jurisdiction and appropriate channels. Marlowe looked at him with the specific quality of patience that wasn't really patience, and the attorney stopped. Today, Pratt said. Yes. Claire left the conference room at 3:15. Not because she was dismissed, Rourke had made clear she could stay, but because the conversation had moved into territory that was Marlowe's and Rourke's, the specific federal infrastructure of a financial investigation that she was a witness to but not an architect of. And staying in the room was no longer the most useful thing she could do with her time or her body, which had now been awake for over 30 hours, and was beginning to register that fact in specific ways she'd been ignoring. She went upstairs. Vance was awake and upright when she came into the recovery room, doing something with his tablet that he put down when she entered. His color had improved over the course of the day in the incremental way of genuine recovery. Not dramatic, not sudden, just the reliable mathematics of a body that was doing what it was supposed to do. Pratt, he said. Cooperating, she said, Toll's the primary. Pratt claims he didn't know the full scope. Do you believe him? She thought about it honestly. I believe he knew enough to ask questions and didn't ask them. Whether that's culpability or negligence is for the attorneys to argue. She sat in the chair. Your team's operation, the financial network. Marlowe's pushing Pratt on domestic connections today. Good. Vance set the tablet aside entirely. It's the right move. The domestic structure is the piece that makes the foreign connections prosecutable. Without it, you have a financial investigation without American jurisdiction. He paused. How are you doing? I've been awake for 30 hours. That's not what I asked. She looked at him, who wasn't performing concern. He was asking the way a person asked when they genuinely wanted to know and wasn't going to manage the answer. It was the kind of directness she was better at receiving from people she'd been in a clinical crisis with, because it was honest in the same way that keeping someone alive was honest. I'm okay, she said. I've been okay. Today has been... She stopped. Tried to find the accurate word rather than the comfortable one. It's been a lot of things at once, and some of them are still moving. Yeah, he said. That doesn't go away fast. I know. You'll be good at whatever you do next, he said. Not as encouragement, not as flattery, just as an observation from someone who had spent the previous 30 hours watching her work. She didn't respond to it immediately. She checked his monitor, checked the line, checked the drainage output from the chest tube, down to 30 milliliters over the last 4 hours, which was exactly where it needed to be. His body was closing its own wounds. It knew what to do. 42 hours post-op, she said. You're tracking well. 6 more hours and you'll let me walk to the bathroom unassisted? In about 8 hours, Whitfield will let you try, after he supervises the first attempt. Whitfield is 28 years old. He's thorough, she said. That matters more than the age. Vance almost smiled. It didn't quite complete itself, which she thought might be the most genuine expression she'd seen from him all day. The State Medical Board contacted the hospital at 4:30 p.m. with a formal notification that Dr. Russell Farrow's license had been placed under emergency suspension pending the outcome of the conduct investigation. The notification came through official channels to Nora Yoon's office and was shared with the recovery floor staff in the particular hospital way. Not announced, just known, moving through the space at the speed of things that people had been waiting to hear. Petra found Claire near the nursing station at 5 and told her without preamble and with the specific expression of a person who had been holding a weight for a long time and had just been told they could put it down. Emergency suspension, Petra said. I heard. He's not coming back on service. Not while the investigation is open. After that depends on what the board finds. Claire paused. They'll find enough. Petra looked at her. Do you want to come back? To this floor? It was a different question from the one Bangs had asked in the consultation room. Bangs had asked whether it was possible. Petra was asking whether she wanted it, which was the question that actually mattered and that nobody else had quite asked in those terms. Claire looked at the nursing station. The board with the patient census, the familiar handwriting of the charge nurse in the column headers, the small perpetually dying plant on the shelf above the monitor bank that someone had been watering optimistically for as long as she'd been here. The particular geography of a place where she'd spent 14 months doing exactly what she was built to do, inside a structure that had been actively working to dismantle her. I don't know yet, she said. Okay, Petra said, and left it there, which was the right thing. At 7 in the evening, Rourke came out of the conference room, which had now been occupied for nearly 4 hours, and found Claire in the corridor and said that Pratt had given them the domestic financial connections, and that Marlowe's assessment was that it was significant enough to expand the existing federal investigation into 2 additional jurisdictions. Tull is looking at federal charges on the financial side as well as the professional misconduct campaign, Rourke said. His attorney is already talking to the prosecutor about cooperation, which means the charges will compound before they reduce. The other 11 nurses, Claire said, the ones at the other facilities. We're reaching out. Some of them may have grounds for civil action independent of the federal case. The federal witness protection and cooperation mechanisms will apply to anyone who comes forward. Rourke paused. You started something by staying accurate, by filing every note. I was doing my job. You were doing your job when it would have been easier to stop, Rourke said. There's a difference. Claire thought about all the moments over 14 months when stopping would have been available. Farrow's reading glasses and his dismissal. Holt's folder growing one document at a time. The badge on the desk. Every moment where the path of least resistance had been to let it go, to be quieter, to accept the framing that her judgment was the problem and the institution was the standard. Every moment where she'd chosen to file the note anyway because the note was accurate and a patient's chart was not the place to manage institutional politics. She hadn't thought of it as courage. She'd thought of it as accuracy. But accuracy, she was learning, was its own form of stubbornness, and in the right conditions, stubbornness was the thing that held. What happens to the nursing board complaint, she said. Formally withdrawn as of 40 minutes ago, Rourke said. The stay was confirmed, the petition was vacated, and the board has received the full evidentiary record showing the complaint was externally drafted as part of a coordinated suppression campaign. They've opened their own investigation into the filing. She looked at Claire steadily. Your record at the board is clean. It will remain clean. There will be no asterisk. Claire breathed in. Let it out slowly. No asterisk. 14 months of documentation and early arrivals and fighting, every clinical battle on 2 fronts simultaneously, the patient in front of her and the institution behind her. And the result was a clean record at the state nursing board and 2 words from a federal agent in a hospital corridor. It was not nothing. It was the opposite of nothing. But it was also just accurate. It was just the truth finally being where it belonged, after a long time of being buried under documentation designed to look like the truth and wasn't. "Thank you," she said. "You did the work," Rourke said. She went to see Delia Ross at 8 that evening. Delia, Breyer, was in a regular surgical recovery room on the 4th floor, 26 hours out from her splenography, doing the specific uncomfortable work of someone whose abdominal wall had been opened and closed and was now registering every movement with commentary. She was awake when Claire came in. Her broad-shouldered frame took up the bed in a way that made the bed look slightly undersized, and she had the expression of a woman who was in pain and was neither performing it nor pretending it wasn't there. She looked at Claire. "You came back," she said. "I was in the building." "I heard you got fired." "I did." "And then unhired?" "Something like that." Claire pulled the chair. "How are you feeling?" "Like I got cut open," Breyer said. "Which I did." She shifted carefully. "The surgeon said they found it because a nurse flagged it, and a military doctor ordered the right test." "The military doctor ordered it. I just passed on a concern." Breyer looked at her with the particular look of someone who had spent her life working with her hands and had developed an accurate nose for people who minimized their own contributions. "Sure," she said. "Whatever you say." She paused. "I told my supervisor at the plant about what I said to you, that I felt wrong." "What did he say?" "He said I should have said something louder at intake." "You did say something at intake. They logged it." "I know." Breyer's jaw set slightly. "I've been thinking about that, about how you have to fight to be heard even when you're the one who's sick." She looked at the window. "I was scared to push harder. I thought they'd think I was being dramatic." Claire held that. The particular logic of it. The way people internalized other people's dismissals so thoroughly that they began to police themselves, began to anticipate the eye roll and moderate accordingly, and in moderating gave the dismissal permission to be true. "You weren't dramatic," Claire said. "You were right." "Yeah, well," Breyer looked back at her. "I'm going to be louder next time." "Good," Claire said. She stayed another 10 minutes. They didn't talk about anything important. Breyer's recovery timeline, the visiting hours policy, the fact that the 4th floor television had 3 channels that actually worked. When Claire stood to leave, Breyer said, "Hey." Claire stopped. "Whatever they did to you here," Breyer said, "I'm glad they're fixing it." Claire looked at her. A woman who'd almost bled quietly into her own abdomen while the institution responsible for her care processed paperwork and prioritized throughput over observation. A woman who had felt wrong and said so and had almost not been heard. "Me too," Claire said, and meant it in more directions than one. Vance's chest tube came out at 9 the following morning, which was the 3rd day, and he walked to the bathroom unassisted at 10, while Whitfield hovered at a respectful distance and tried not to look like he was ready to catch him. Whitfield had grown on Claire over 30 hours in ways she hadn't anticipated. He was methodical in the way that young physicians who were going to be good eventually were methodical, which was to say he was careful about the things he didn't know and honest about the boundaries of his own certainty, which were rarer qualities than they should have been. Marlowe came to the recovery room at 11 with the particular quality of a man who had been working through the night and had reached the specific stage of a long operation where the immediate crisis was resolved and what remained was architecture. "Tull entered a cooperation agreement this morning," he said. "The prosecutor accepted. He'll provide full testimony on the financial network in exchange for reduced charges on the professional misconduct campaign." He paused. "Reduced, not eliminated. The 11 nurses and 2 residents still have the federal witness mechanism available to them. The civil exposure for Meridian is the attorney's calculation, but I'm told it's significant." "What about Pratt?" Claire asked. "Cooperation agreement as well. He's a witness, not a defendant, provided his disclosure is complete and accurate, and he had no direct knowledge of the misconduct campaign." Marlowe said it without heat. "The financial network investigation continues independently. That's a longer timeline." Vance from the bed. "Longer is fine as long as the thread doesn't get cut." "The thread is solid," Marlowe said. "Your debrief and Pratt's disclosure give us 2 independent lines into the same structure. It'll hold." He looked at Claire. "I need to talk to you about what happens next." "I know. Not right now. When you're ready." "I'm ready now," she said. "I've been ready since the cafeteria." Marlowe looked at her for a moment. Then he closed the door. The offer was structured in a way she hadn't expected, which meant Marlowe had thought about it from her angle rather than from the military's, which she appreciated. It was not a return to active service. It was a position with the SOCOM Medical Liaison Office, the same unit Marlowe ran, as a civilian training specialist for combat trauma protocols. Specifically, field adaptation of advanced trauma assessment, the kind of clinical pattern recognition that operated at the edge of available resources. In conditions where the imaging wasn't available, and the consultation wasn't coming, and the decision had to be made on what you could see and hear and feel, and the knowledge you'd accumulated across years of being the last person in the room. The knowledge that had caught a tension pneumothorax in a Blackhawk in a hospital parking lot in Casper Falls at 7 in the morning. The knowledge that had caught Marco's pupils and Garrett Town's pressure curve and Delia Ross's left upper quadrant, that had noticed what the automated systems and the credentialed physicians had moved past. Not because it was magic, but because she had been paying attention the way she'd been trained to pay attention in conditions where not paying attention meant someone died. She was going to teach it. The first cohort is 62 combat medics, Marlowe said. Mix of experience levels. The curriculum is designed by you. We have a framework, but I want your clinical judgment on the specifics. You know what the field actually looks like. Where? Braxton, initially, possibly Fort Arden in the second cycle. He paused. Your federal witness status means your movements are coordinated with Rourke's team for the next several months. They've approved the posting. She thought about the 11 nurses in 4 states. About Breyer being louder next time. About Marco's mother crossing out the printed sentiment in a get well card because the printed sentiment wasn't enough. The training curriculum, she said, can it include something on institutional recognition? On how to document clinical concerns when the environment is actively resistant to hearing them? Marlowe looked at her. Explain. Combat medics go into civilian facilities. Some of them will encounter the same patterns I encountered here. The hostile attending, the documentation that disappears, the pressure to recalibrate their clinical instincts to match the institution's preferred read. She said it carefully, because she was still building it as she spoke. If they know how to document accurately under those conditions, if they know what a clean clinical record looks like when someone tries to build a paper case against it, it protects the patients and it protects them. Marlowe was quiet for a moment. Write that into the curriculum, he said. I'll approve it. She left Harlow County General at 2 in the afternoon on the 3rd day. Not fired this time. Not walked out. She signed the paperwork Bangs had prepared. The formal reinstatement, the corrected record, the documentation of the wrongful termination and the clean outcome. She signed it because it needed to exist, because the record needed to reflect what had actually happened, and then she handed it back to Nora Yoon and shook Bangs' hand and walked out through the main entrance instead of the ambulance bay. Petra was at the nursing station when she passed through the ER. They didn't make it ceremonial. Petra said, "Stay in touch," and Claire said, "I will." And both of them understood that this was an accurate promise rather than a polite one, that the thing they'd built across 14 months of watching each other work in difficult conditions was not the kind of thing that dissolved with geography. Rodrigo was in the break room and came out to say goodbye and looked like he was going to say something formal, and then just said, "You made this a safer floor," which was not formal at all, and which was the truest thing anyone said to her that day. She stopped at Bay 3 on her way out. Empty now, already reset for the next patient. Clean sheets, cleared monitor. The small impersonal efficiency of a space that processed human crisis and moved on. She stood in the doorway for a moment. Not grief, not nostalgia. Just the brief acknowledgement of a place where something had mattered. Then she walked out. What? The drive to her apartment took 11 minutes. She sat in the Subaru in her parking spot for a while, not the way she'd sat in the hospital parking lot 2 mornings ago. Immobile in the specific suspension of a person whose world had just been reconfigured, but differently. Quieter. The way you sat somewhere familiar when you knew you were leaving it and were taking a moment to get the look of it right before you went. She went inside. She showered for a long time, which was practical and also not entirely practical. She ate something real, actual food, assembled in her kitchen, the first time in 3 days, and sat at her small table by the window and watched the late afternoon light do what it did with the ridge and the valley and the ordinary, unremarkable sky over Casper Falls. Her phone had messages she hadn't answered, a voicemail from the civil attorney who'd given her his card 3 months ago, which she'd return tomorrow. A text from Solis. Testified today. Board investigator said it was useful. 3 messages from numbers she didn't recognize that were probably journalists and would remain unanswered. 1 text from Whitfield that said, patient is asking about discharge timeline. Telling him Friday. He's unhappy. Also, thank you for everything. I learned a lot. She texted back. Friday is correct. Tell him early ambulation helps. And you're welcome. You were good. She held the phone for a moment after she sent it. She thought about what it cost to stay accurate in environments designed to make accuracy expensive. She thought about it not as an abstract thing, not as a principle or a lesson, but as the specific physical experience of arriving 12 minutes early to a job that was trying to remove you, of filing a note into a chart that nobody was going to read, of pressing a hand flat against a patient's chest, and trusting what you felt when everyone around you was invested in you being wrong. It cost something. It always cost something. And the cost didn't get refunded when the outcome was right. Not fully. Not in the clean way that stories sometimes implied. What you got back was not the cost reimbursed, but the knowledge that paying it had mattered. That Marco was in college somewhere, or would be. That Garrett Town had gone home with a functioning aorta. That Breyer would be louder next time. That 62 combat medics would learn to document under pressure in a way that protected them and protected the people in front of them. That was not nothing. That was in fact the whole thing. She pulled the blank folded piece of paper from her jacket pocket, the one she'd carried for years, the habit she'd never been able to explain, and unfolded it on the table, still blank. She'd carried it as ballast through field rotations and civilian ERs and 9-minute terminations, and a surgical suite in the middle of the night, and a federal witness designation at a cafeteria table. She'd always meant it as something she might need to write down. Some note, some accounting, some record of whatever turned out to matter. She got a pen. She thought for a moment. Then she wrote 1 word, folded the paper back along its original crease, and put it in her jacket pocket for the last time before she went to pack. She left Casper Falls on a Saturday morning, the valley still half-shadowed when she loaded the last box into the Subaru. The apartment was clean and empty in the way rented spaces always were when you finally surrendered them, slightly larger than they'd seemed when furnished, slightly impersonal, already forgetting you. She drove the first hour without the radio. The road went up through the eastern ridge before it dropped into the wider flatlands beyond, and for a few minutes at the summit she could see the whole valley spread below her. The city, the hospital, the river that ran along the south edge, the industrial sprawl of the packaging plant where Breyer worked, the lacrosse fields at the school where Marco had gone. All of it ordinary. All of it, from up here, looking like exactly what it was. A place where people lived and got sick and needed someone to pay attention. She looked at it for the distance it took to cross the summit. Then the road descended and the valley dropped out of the rearview mirror, and she drove forward into the flat, bright morning and thought about 62 combat medics who didn't yet know that the most important thing she was going to teach them wasn't a procedure or a protocol, but a posture. The specific posture of a person who has learned to trust accurate observation in conditions designed to make them doubt it, who has learned to file the note when no one is going to read it, who has learned that the work matters even when the institution doesn't see it, that the patient in front of you is more real than the write-up behind you, that staying right when it's expensive is the only version of this job worth doing. Not because it would always be recognized. It wouldn't always be recognized. Not because the institution would always correct itself. It wouldn't always correct itself. But because somewhere in an ER at 3 in the morning, a 16-year-old's pupils were going to be unequal, and a woman was going to feel wrong in her left side and be right about it, and an operator was going to need someone to say drain the chest first in a voice that meant it. And in that moment, all of it, every expensive accurate note, and every 12 minutes early morning would converge into the one thing that mattered, someone paying attention. She reached into her jacket pocket and touched the folded paper and left it there. On it, in her own handwriting, 1 word, enough, not as surrender, not as settling, as the specific human understanding that the thing she had been, the thing she had refused to stop being when it cost her everything, had always been exactly enough. Enough to catch what needed catching, enough to hold what needed holding, enough to walk out of a parking lot toward an unknown number and say yes and mean it. Enough to show 62 people how to stay accurate in a world that would periodically make accuracy feel like a liability. It was enough. She drove toward the mountains, and the morning opened ahead of her, and she did not look back again.